share the link, please?
YouTube live, ma'am.
Yes.
I'll send you, ma'am.
Hello, everyone. Today's class is Physiology of Hearing, and I'm Dr. Nawal here to talk to you about the physiology of hearing. So before we start, we'll have a small convo about what is Auricle and how does it work. So Auricle is a 90-day university pre-final mastery, and today's class will be Audiology and Acoustics, assessment of hearing, and also hearing loss. So it is a platform where you will have a revision of all important questions that will be coming up in your exam modules, your final year exams, your internals, and also for next exam. And we'll have a volatile fact quick revision for the exams. We'll have high yield topics for all the subjects, not just ENT. We have it for anatomy, physiology, pharmacology, forensic, and most expected topics will be covered here. We prepared for the next exam as well. Okay. So here for today's topic, we have a long essay question that is physiology and mechanism of hearing. It is a very important question, and not everyone gets a clear overview about this topic. And I hope I am able to fulfill the expectations of the students that's here on their platform. Now, we have short essay questions, tuning fork test that we have done in first year physiology as well, practicals. Then we have Rennie and Weber's test and Gelling's test. We have fistula test, or we say false positive fistula sign, caloric test, Vincent angina, tympanometry curves, which are very important. You just have to learn the diagram for that. And if you just draw the diagram and label it properly, you will get enough marks in the exams. And the last topic for today will be neonatal hearing screening. So why do you have to choose Auricle as a platform? Is because we have recorded classes, we have live classes just like how we have now. We have practical sessions coming up. We'll prepare you for your practical exams like Viva questions, how to use instruments, how to see X-rays and everything required for practical sessions. We have exam modules prepared for you before writing the exams, and we have hard copy book sets as well. Coming to a point of recorded classes, here you have a flexible learning. All the classes will be recorded. You can come back anytime and reread or re-attend the class. We have expert instructions, convenient revisions. That's what you can pick up from the recorded classes. And from live classes, we have in-depth coverage of the topics. We have experienced educators there, and we have an interactive learning session where you can come in, join the class, ask questions if you have any, or clear the dots if you have any. And we have express exam module where we complete the syllabus in 20 hours. But this is only a revision before the exam. You will have to attend the live classes and you will have to see the recorded classes before you come and you make a fulfilled use of this express exam module. And we'll teach you how to answer the writing skills. We'll teach you how to write in the final exams. And we'll have an expert educators on this platform for you. Of course, we'll have one-to-one doubt clearing sessions where students can have a centric approach. We'll give a personalized attention to every student required according to their benefits. And we have a safe learning environment, which you can make use of. We have hard copy note sets where you will have in-depth coverage. That those are made by educators who are very experienced and they are highly qualified, and they will teach you in this book sets how to write the answers, and they will give you appropriate study plans and much more required. We'll have MCQ polls and Viva Vogue questions, and you will be able to clear doubts when through these books as well. We have an online app which is very interesting. Everyone can download this app in their mobile phones. It will be very handy, not just mobile phones, in their tablets as well. It's a 3 level of expertise constructure. All right. It's a beginner level to expert level app. You can choose your level and you can start answering the MCQs. This will help you for your next exam as well. It covers MCQs for professional exams, next, MLE, form, whatever required, NEET, PG and FMG, everything. Okay. Practical sessions will have an hands-on experience with experienced educators. They'll teach you how to prepare for yourself in a practical exam. You will have guidance by the professors for all the subjects throughout your MBBS, and we will excel you in your practical exams. We have 4-year subscription plan. One is basic, where you will have benefits, but you will not have hard copy note sets and you will not have doubt clearance sessions. The rate is written down on the screen. And we have other 3 plans: advanced learning plan, complete learning plan, and ultimate plan. In advanced learning plan as well, you will not have hard copy note sets and one-to-one doubt clearing sessions. It's just the other 2 plans where you will have full benefits. The last plan is an ultimate MBBS plan where you will have 4 years of subscription to this application and you can follow up with whatever subject you want. You can use the QR code Dr. Nawal MOHAMMED 20 for discount on subscription. Okay, now coming to the physiology of ear. So sound signal in the environment is collected by pinna. So let's start. So I'll draw a structure of ear here. So let's assume this is your pinna. Okay, so the sound is connected by pinna. So let's say the pinna localizes the sound. Okay, and it passes through the external auditory meatus. This is your external auditory meatus. Okay, external auditory meatus amplifies your sound. Amplification of the sound. All right, and then it strikes the tympanic membrane. So if this is the tympanic membrane, so it will strike down here. So let's mark ear. This is the sound entering the ear. It will strike down the tympanic membrane. Now here, just for your information and for your depth knowledge. So your tympanic membrane is a big drum, right? Like this. And we have a muscle here, pars tensa. Now, when this gets vibrated, the sound doesn't hit the center of the pars tensa. It hits the periphery. So if the tympanic membrane is placed here, the vibration occurs from the peripheries of the tympanic membrane. Now, this vibration of the tympanic membrane transmitted to stapes foot plate through a chain of ossicles. Coming to the point, ossicles. What are ossicles? Ossicles are made up of 3 bones over here. That's malleolus, incus, stapes. 3 bones. So we'll have a bone attached like this, and then we'll have one more bone attached like this, and then we have structure like hammer like this. Okay. So vibration of tympanic membrane is transmitted to the stapes by ossicles. Here, ossicles means the 3 bones, and that those bones are attached to the tympanic membrane. So the movement of stapes foot plate. So this foot plate. So stapes is like this in structure. Right? This is the foot plate of the stape. So the movements of stapes foot plate, it causes the changes in the pressure in the labyrinth fluids, which move the basilar membrane. Now here you will have to understand the anatomy of cochlea and the physiology of cochlea to understand how the basilar movement moves. And this basilar movement will stimulate the hair cells of organ of Coti. So I'll draw a diagram. Let's do it here. So this is pinna of the ear, external auditory canal. The sound hits the tympanic membrane. Malleolus stapes. Now, here around the stapes, we have cochlea. So cochlea is a pole. Draw something like this. Okay. So cochlea looks like this. All right. So what actually happens inside the cochlea? What is the basement membrane of the cochlea? So when you cut open the cochlea, there are cochlear cells. We learned this in the first class. The cochlea is divided into 3 compartments. One is scala vestibuli, okay? One is scala media, and one is scala, okay? Scala vestibuli, scala media, and scala tympani. Now, scala vestibuli is the upper part, and scala tympani is the lower part. Now, organ of Coti and the basement membrane lies in the media. Here. Here is where you see the organ of Coti. We'll zoom it in and we'll understand what happens there as well. But before that, you need to understand that cochlea is main for hearing sounds. So it is main for hearing sounds and to send the signals to the brain. If there's cochlear dysfunctioning, you will have hearing defects. Okay, and sound waves enters into the cochlea through a window that is known as oval window. We have studied this already in the anatomy of middle ear, that we have an oval window in the middle ear, right? So it will be somewhere here. So the sound waves will enter into the external auditory meatus, hit the tympanic membrane, and from through the oval window, it will hit the cochlea. Now, cochlea is located in the inner part of the middle ear. Middle ear is divided into 3, outer, middle, and inner. In the middle part, you have half of the tympanic membrane, you have ossicles, 3 bones, and cochlea comes in the inner part of the ear. Now, what happens here is that let's zoom in into the cochlea. So cochlea, we have understood that cochlea is around 35 millimeter long foil. Okay, it is 2 by 3 quarter turns. We have already studied that it has an ampulla, it has a vestibular system, it has macula, sacula, utricles. You can see it on your screens. Now, what is inside cochlea and where is cochlea located? Cochlea is in the inner middle ear, inner part of the ear, and organ of Coti is which is important. So it is located in the media of the cochlea. Now, if you come down to this diagram, you can see the basement membrane. So let's just take a small picture here. I'll just draw. Let's say this is scala media. Okay. We have scala vestibuli up, we have tympanic down, and we have scala media in between. So scala media, you will have a basement membrane like this. You can follow up with this diagram. We have a basement membrane here. We have 2 hair cells, 2 types of hair cells. One is outer hair cell and one is inner hair cell. So let's draw that. So this is outer hair cells. Okay. 1, 2, 3. 1, 2, 3. Right. And we have an inner hair cell like this. We have something called tectum tympani above this. It's like a mountain above the hair cells. Now what happens is that when your sound enters from the tympanic membrane into your cochlea, these outer hair cells and inner hair cells are stimulated by the movement of basilar membrane. So the basilar membrane will start moving, it will vibrate. And that vibration will start stimulating the nerve fibers that is attached to the hair cells. And those hair cells will start brushing on the tectum tympani. Here we have tectum tympani. Okay. So tectorial membrane. So it will start brushing that tectorial membrane. And now what happens is that tectonium membrane will start sending the sounds down through the signal, and it will enter into your nerve, auditory nerve. And that auditory nerve will send the signals to the brain. Now we have a pathway of auditory, we say it as a neuronal auditory pathway, where we will go into the broader conclusion to that. But just understand that from the pinna, the sound goes inside into the external auditory canal. From external auditory canal, the sound enters into the tympanic membrane. It stimulates the tympanic membrane. After the tympanic membrane gets stimulated, the ossicle starts moving. And the foot plate of stapes, it will start stimulating the cochlea. And in cochlea, we have media where we have organ of Coti. So the basement membrane there gets stimulated. All right. And then that stimulated basement membrane will start moving the outer and the inner hair cells. Okay. And those hair cells will send the signals down from the nerve fiber to your brain. That is the basic point that you have to understand. Okay? Okay. The mechanism of hearing can be broadly divided into 3 parts. One is mechanical conduction. 2 is transduction. And 3 is conduction. So first what happens? The sound will enter. Then it will get transducted of mechanical energy to produce electrical impulses in the cochlea. And then it will conduct those electrical impulses to the brain. Okay? Now, we'll just have a brief read through this. So lever action of ossicles, handle of malleus is longer 1.3 times than the long process of incus. All right. So hyaluronic acid of tympanic membrane, hyaluronic action of tympanic membrane, and the area of tympanic membrane, which is much larger than the area of stapes of foot plate. So the average ratio between them will be 21:1. Just for your knowledge, as the effective vibratory area of tympanic membrane is only 2/3, the effective areal ratio is reduced to 14:1. And this is a mechanical advantage provided by tympanic membrane. So here they want to make a point that tympanic membrane is larger than the stapes foot plate. All right. So there is larger sound conduction entering into the middle ear. Okay. Now what happens after the sound crosses the tympanic membrane? There is transition of mechanical energy to electrical impulses. So the movement of stapes foot plate is transmitted to the cochlear fluids. Now here, cochlear fluids are in the, so this is scala vestibuli, scala media, and scala tympani, right? So here we'll have fluids, and here we'll have organ of Coti. Okay. So movements of stapes of foot plates, movement of basilar membrane is stimulated when the cochlear fluids starts transmitting the sound. So the media that is in the between, it moves with the pressure of those those cochlear fluids. So that will lead to distortion of hair cells, and it will give rise to cochlear microphonics, which trigger the nerve impulses. Just like how I showed you that the hair cells, they will be having nerve down like this. So when these hair cells are moving, they will stimulate the nerve impulses. All right. And a sound wave, depending upon the frequency, reaches the maximum amplitude on a particular place on the basilar membrane and stimulates the segment. Here, what actually happens is that it depends upon the frequency of the sound that which part of the basilar membrane stimulates. Okay. This is known as traveling wave theory of von Beckie, which says that specific part of basilar membrane is stimulated by specific amplitude. Higher frequencies are represented in the basal turn of cochlea and progressively lower ones towards the apex. All right. Now, what happens when there is a neural pathway? When the sound enters into the neural pathway, the hair cell gets innervated from bipolar cells of spiral ganglia. So here we will start with a pathway of auditory pathway. So what happens is the spiral ganglion will get stimulated. Let's assume this is spiral ganglion. So the sound has traveled from the pinna into external auditory meatus and then tympanic membrane and then ossicles stimulate the cochlea. Cochlear fluids will stimulate the media. There the hair cells will start moving because the base membrane moves and those impulses are traveling from the nerves. Now it will enter into the spiral ganglion. Okay, all those impulses are collected in the spiral ganglion from cochlear nerve. That will go into the ventral and dorsal cochlear nuclei. From here, we will start our auditory pathway. Okay. Auditory pathway, I'll give a small brief of auditory pathway. Let's go to the last page so I get a clean page. Okay, here we can draw it here. Okay, so let's say this is your medulla oblongata. We have studied already this topic in physiology. Let's not go into the depth. We know there is ventral nuclei and dorsal nuclei in the medulla oblongata. We have superior olivary nucleus on both the sides, right? So here it mentions that from there, both crossed and uncrossed fibers travel into the superior olivary nucleus, lateral lemniscus, and inferior cochleus and medial geniculum. From here, we have three order neurons, first order neuron, second order neuron, and third order neuron. Second order neuron will have four parts. So let's say this is superior olivary nucleus. We have lateral geniculate body that will be this. And then we have lateral lemniscus, inferior colliculus, and medial geniculate body, right? So it is medulla oblongata, midbrain, and from here it will enter into the auditory cortex like this. This we have studied in the physiology, where you will have impulses traveling from the spiral ganglion. All right, from here, it will enter here, and then from here into the ventral and dorsal. Sorry, I wrote it in a wrong way. This will be dorsal and this will be ventral. Dorsal, ventral, right? This will be medulla oblongata. From here, what will happen? The nerve impulse, the sound will travel from the spinal ganglion that is in the cochlear nerve, and from there it will travel into the superior auricular nucleus like this. And from here, one will enter into the opposite side and the other will enter into the ipsilateral side. So sound travels like this. So from both crossed and uncrossed fibers. So one is crossing from the intermediate trapezoid and one is crossing on the same line. And it will travel to the superior olivary nucleus and then into the lateral lemniscus and inferior colliculus and then medial geniculate body. And then from there, they will finally reach the auditory cortex of the temporal lobe. So let's have a revision, just a small go through. We have pinna of the ear, the sound travels here, right? And then into the external auditory canal. Here it amplifies the sound. External auditory canal amplifies the sound. Then it will enter into the tympanic membrane, where tympanic membrane gets vibrations. And then we have ossicles here, three bones of the ear, malleus, stapes, and incus, right? Stapes will have a foot plate that will stimulate the cochlea. Now, cochlea is divided into three: vestibuli, media, and tympani, right? And then media will have the hair cells. We have two hair cells, inner and outer hair cells. These hair cells will stimulate the nerves, and from the nerve, the sound will enter into the spinal ganglion, and from there it will form an auditory pathway. In auditory pathway, we have first order neuron, second order neuron, and third order neuron. It's a deeper topic, and we'll have it in our next class. Okay. And from there, we'll have internal trapezoid, where the nerve fibers will cross and it will enter into the ipsilateral side and the contralateral side in the opposite side. Okay. Now let's come back to the topic of tuning fork. So in tuning fork, we again have these classes in practical during physiology. So it is important that you know the basics. I'll just give you small mnemonics so that you don't forget it. You can say Rennie in the penny. Okay. Rennie in the penny. So what does it mean is that Rennie test is done, as we all know, it is done by tuning fork. So Rennie test is when you vibrate the tuning fork and you put it behind the pinna or you put it on the mastoid bone. So the mastoid bone is behind the pinna, right? So the mnemonic Rennie in the penny is a small mnemonic which you can remember. In Rennie's test, what you do is you vibrate the tuning fork and you put it behind the pinna. You put it on the mastoid of the bone, mastoid part of the bone. Now, what happens here is that always remember, normally a human being's ear, air conduction will be more than bone conduction. So the sound that travels through the air is louder than the sound that travels through the bone. Okay. Now, when you do a Rennie test and it becomes positive, what does it mean by it is positive? When air conduction is longer or louder than the bone conduction. Okay, this is called positive. It means the patient is having normal hearing. Now, it becomes negative when you vibrate the tuning fork and put it on the patient's mastoid bone. And after sometimes you move it to the air, like in front of his ear. If he says, I can hear the sound better when you put it on my mastoid bone behind the pinna, that is called bone conduction more than air conduction. It means he has conductive hearing loss. This is very, very important topic in your academics. also in your practical life, and also in your professional exams like NEET PG and FMGs, USMLEs, IFOM, next exams, probably it will be important there as well. It is very important and everyone should know it. Remember the mnemonic Rini in the penny, that means behind the ear, mastoid bone. You vibrate the tuning fork and you put it behind the ear, behind the pinna on the mastoid bone. If the patient says, I can hear this, and then you slowly move it in front of the ear. Okay. Now, if the patient says, I can hear the sound better when you put it back on my bone, it means the bone conduction is better than the air conduction, which is actually not a normal case. Normally, a human ear can have on better hearing when there is air conduction. So if it is bone conduction better than the air conduction, it means that the patient is having conductive hearing loss. Okay. Now we have one more called Weber's test. Here what you do is you vibrate the tuning fork and you put it on top of the head, maybe on the forehead or maybe on the temple bone. Let's say frontal bone or temporal bone. Now what happens here is that normally a normal patient will be able to hear sounds equally on both the sides. Let's write it equal. Okay. Now, it is lateralized to worse ear in conductive deafness and to better ear in sensory neural deafness. So here, what does it mean is that when you vibrate the tuning fork and you keep it on the head of the patient, like let's say on the temple bone of the patient, if the patient is able to hear it better, it lateralizes to the worse ear. If he is able to hear in the ear where he's complaining, then it is a conductive deafness. Okay. Now, and to the better ear, then it is a sensory neural deafness. Sensory neural deafness. Okay, in Weber's test, sound travels directly to the cochlea via the bone. So here what you do is you vibrate the tuning fork and you keep it on the head, frontal or temporal. So the sound directly transmits from the bone in the cochlea. Remember, cochlea is an important part of hearing. If there's damage in the cochlea, then you will definitely have hearing dysfunctioning. Okay, in Weber's test, sound travels directly to the cochlea via the bone. Now, if there is lateralization to the worse ear, that means it is conductive deafness. And to the better ear, it is sensory neural deafness. Remember this. When you vibrate the tuning fork and keep it on the bone, it will stimulate cochlea directly. If it moves to the worse ear, it is conductive deafness. And if it is to the better ear, it is sensory neural deafness. Okay. Now, what is Galley's test? It is an addition to what you do in Weber's test and Rennie's test. Here you vibrate the tuning fork and you keep it behind the ear. Okay. And you actually, this test is done to examine the effect of hearing quality when there is an increased air pressure in the ear. So what you do is you use an instrument called Segel speculum. If you can see here, Segel speculum. Okay. This is the instrument you use to increase the pressure in the ear. And you examine the patient and you'd see if his hearing is normal when you increase the pressure in the ear. So normally when air pressure is increased in the ear, it pushes the tympanic membrane and the ossicles, everyone outside. So imagine you're trying to push something, you're trying to increase the pressure in the ear, you're trying to send the air in the ear. So the tympanic membrane, the ossicles, they will all move inwards. And that will raise the intralabyrinthic pressure and causes the immobility of basilar membrane. Now your basilar membrane is moving. And that will lead to a decreased hearing. Okay. See. Here, it pushes the tympanic membrane and the ossicle inwards. That will raise the intralabyrinthic pressure and it causes the immobility of the basilar membrane and decreases the hearing. But there is no change in hearing when observed if the ossicular chain is fixed and disconnected. Now let's assume this motive is to increase the pressure in the ear. You push the air inside the ear and everything moves inside. But if the ossicular chain is so fixed or maybe it's disconnected. This will not affect the hearing part. Okay, so in Gelly's test, it is performed by placing a vibrating fork on the mastoid cells, while the air pressure is sent in the ear canal, and it is done by a Siegel speculum. Remember the name Siegel speculum. Now, Gelly's test is positive in normal people, okay, and those with sensory neural hearing deafness. So let's write it down here. It is positive in normal and also in sensory neural hearing deafness, SND. Okay, but it is negative when ossicular chains are fixed or disconnected, because the ossicle chains are not, it's either they're so fixedly sitting on the basement membrane that they will not move, or they are disconnected. So it's not going to affect them. The pressure is not going to affect them. So it is negative in people who have ossicular chains fixed or in disconnected cases. All right. So let's repeat what's Gillies test. You vibrate the tuning fork and you put it on the mastoid bone, and simultaneously you increase the pressure in the ear by a Siegel speculum. What this pressure will do is it will push the tympanic membrane and the ossicles inwards, and it will increase the intralibranite pressure. Now, what will happen is that this will create an immobility in the basilar membrane, and this will reduce the hearing of a patient. But if the patient is having a fixed ossicular chain, or maybe it is disconnected, then the patient will not feel the effect. So here, what it means is that normally it becomes positive when the patient is having sensory neural deafness, or when it is normal. But it becomes negative when the ossicular chains are either fixed or they are either disconnected. Okay, it was a very popular test done to find the fixation of stapes in cases of otulosclerosis, but now it's done by tympanometry. Now, coming to caloric test, you have to hear this very carefully. Caloric test, what will happen is that here we use two temperatures of water, cold water and warm water. What we do is we put cold water, and then later on we put warm water in the patient's ear, and we have to see the movement of the eye. So let's say this is to induce nystagmus by thermal stimulation of vestibular system. So you stimulate the vestibular system of the patient and you try to see if this patient is having nystagmus or not. And from the type of nystagmus, you will find out what's the problem in the patient's ear. So patient is also asked whether vertigo is induced by caloric test similar to the type experienced by him during episodes of vertigo. You can also do it in the patients of vertigo who are telling you that, I feel dizzy. I feel like, everything is spinning around me, or maybe I'm spinning around. That's called vertigo. So when the patient is having vertigo, you can do this test and you can ask him if he's having those episodes that he used to experience before when you do this test. Okay. If yes, it means that the vertigo is because of hearing some problem in the ear, maybe libranate origin of vertigo. Okay, I repeat, if a patient comes to you with the problem of vertigo, you can do this test on that patient and you can ask him if he's having the episode of vertigo just like how he used to have before doing this test. And if he says, yes, I have an episode of vertigo, I feel things are spinning around me, then you can tell him, okay, you might have a libranate origin of vertigo. So what happens here is that you induce cold water in the patient's ear. Let's say this is your patient and this is his eyes. Okay. Now you induce cold water in the patient. Okay. Now what happened is that when you induce cold water, the eye will initially move. Let's assume you put the cold water in right ear. So the patient's eyes will move towards the right side. Okay. Let's say cold water, same side. Okay. Now, if you induce warm water, this is cold water. Now, if you induce warm water, the patient's eyes will move on the opposite side. So, WO. This is a mnemonic. When you induce cold water, the patient's eyes will move on the same side. And when you induce warm water, the patient's eyes will move on the opposite side. Now, what happens? This is the initial stage. Now, when the nystagmus comes in, okay, nystagmus comes in. So let's say you induced water in the right ear. The nystagmus will happen on the opposite side. So then that is CO. Okay. And when you induce warm water, the nystagmus will happen on the same side. WS. Cows. Okay. So initial eye movement, when you induce cold water, the eye moves on the same side. Okay, when he tries to move his eye backwards, after some time, the nystagmus will happen on the opposite side. When you induce warm water, the eyes will normally initially move on the opposite side. But after some time, when nystagmus happens, it will happen on the same side. Remember this, CSW is initial, WO is initial, and COWS is when nystagmus happens. Okay? This is caloric test. No, this will come for a 4 mark. You will have to write everything. This is just an explanation. You can go back to the textbook called Dhingra and you can read it carefully and underline the points where you have to explain in the exam. You have to explain that what happens initially when you induce cold water in the ear, and you have to explain what will happen to the eye, which direction the nystagmus will move after some time when you induce the cold water. Same goes with the warm water. You will have to explain this test in the exam. Okay. Now, what is Winsett angina? It is an insidious onset with less fever and less discomfort in the throat. So there is fever, let's say low-grade fever, and the patient will have some discomfort in the throat. Here, what happens is the membrane, which usually forms over the tonsils, can be removed, revealing an irregular ulcer on the tonsil. You do a throat swab that will show both the organisms of typical disease, namely fusiform bacilli and spirochetes are present. So if you do a swab test on the patient, you will see these two bacteria, fusiform bacilli and spirochetes on the patient. Winsett's angina totally related to the tonsil. Now, coming to the point of tympanometry. Here we have a very beautiful graph that can confuse you in exam. This can come in next exam as well. And they might ask you to label the diagram in next exam. In theory, they will just give you the word tympanometry, where you will have to draw this diagram and explain what's going on in the diagram. So what actually happens in tympanometry is that you have a probe which you place in the ear. And that probe has 3 parts, okay? An ossicular part, a part where there is air, that air pumping part, and there is something called microphone. So I'll draw the diagram and explain you. Let's say this is an ear, okay? And you put a probe. All right? So we have an ossicular part of that probe. We have a part which will pump air. And we have a part with a microphone. Okay, this part of microphone will produce sound waves. So sound, what is the main motive of this test is to sound reflected by the air. We have to see the sound that is reflected by the ear, and we'll have to see the compilance of the ear when pressure changes. So if you put a pressure in the ear by air pump, you will have to see how compliant your ear is. All right. So let's say, see the graph where it shows A. Okay. In tympanometry graph, A is normal. Okay. That means the compilance of the ear and the sound reflected by the ear when the pressure is changing is normal. Compilant means the transmission of the sound through the ear. Okay. It is normal. Now, when you see AS, Okay. AS means reduced compliance. That means your ear is not able to transmit sound properly. So reduce compliance and an ambient pressure. So I'll write it down here. AS seen in cases of otosclerosis. Okay. Here what happens, it stands for shallow tympanometry, where you can see the wave is very shallow. It is not peak. Okay. And here you should remember that S stands for stiffness. Okay. Stiffness. So AS is a shallow tympanograph. Okay. It is seen in otosclerosis and it is reduced compliance to the sound. Now, AD, it is a tall wave. We can see here. It is when the compliance of the ear is increased. Okay. AS, compliance decrease. AD, compliance will increase. So what will happen is here, when you put the pressure inside the ear, it will increase the compliance. Okay. And D stands for deep tympanometry. Deep wave. Okay. Here you should remember that it is due to disruption of auricular chain. AS because of otosclerosis and AD is because of disruption of auricular chain. Now we have a flat line behind that is called as B, marked as B. It is the impression of fluid in the middle ear. Okay. I hope everyone is able to understand the class. If anyone is having any doubt, you can ask me, please, in the end of the class. So B is where the fluid is in the middle ear. It shows the impression of the fluid in the middle ear. Now coming to C, this part, it is maximum compliance. Okay, so we have a decreased compliance, we have increased compliance, and we have maximum compliance. Maximum compliance of the ear means that you have to put the pressure more than 200 mm H2O. Okay, and this is a sign where you can understand that the osteition tube is either obstructed or it is a case of otitis media. It means there is some obstruction going on in the osteition tube. Okay, so C means obstruction. It is the compliance which is maximum. Okay. So let's reread it. A wave is a normal wave. AS means stiffness. S, stiffness seen in otosclerosis. AD is decreased compliance. AD is increased compliance. It is disruption of auricular chain. It is a deep wave. All right. And then we have B, that is a flat line which shows the fluid in the middle ear. And we have C, which is a maximum compliance, that is the pressure of more than 200 mm square. Okay, it is due to osteition tube obstruction or early stage of otitis media with effusion. All right. Coming to the last topic of the day, screening of neonates. Now you do this, and this is useful in a condition where the parents come to the hospital and tell you that my child is speaking late or he's not able to hear when I call him and he's not able to understand. So the patients here actually, they will have language, child will be language deficit. It's either they will talk late or they will not talk at all because they will not be able to hear the words. They will be either completely deaf or they will have some hearing dysfunction. Okay, so they are employed to test hearing in high-risk infants and are based on infants' behavioral response to sound signal. So how does the child respond to the sound signal? Now, it is observed that 90% of children with one or more risk factors have normal hearing, not loss, normal hearing. On the contrary, 50% of children with sensory neural loss had no risk factors. Okay, these leads to a program of universal neonatal screening for early detection. There are two important tests done to study the otoacoustic emission. Now, what is otoacoustic emission? Here, what you do is you send a small sound by one part of cochlea. This will stimulate by a soft click sound. So you stimulate the cochlea by sending a small click sound to the ear of a neonate. And you will understand if he's having any hearing defect or not. So OAEs are generated at outer hair cells and they can be picked up from external ear as the energy is produced by them and it travels in a reverse direction. Okay, from the outer hair cells to the ossicles to the tympanic membrane and then the ear canal where it is picked up. So what you do is you attach a machine to the child's ear and you produce a small sound called tick. And this will stimulate cochlea. Okay, and you can understand by the graph of tympanometry if he's having hearing loss or not. Now, OAEs are absent if outer hair cells in cochlea are non-functional. Okay, so outer hair cells are not functioning normally, they will be absent. Or when there is a middle ear effusion like otitis media, or there are some debris due to mucinium that will be there for 3 to 4 days in the patient. So remember, OAEs are absent when you have middle ear effusions, or there is some non-functioning of outer hair cells, or there are some canal debris. I'll mark it down here for you. Cochlea are non-functional. If there is middle ear effusion or there is canal debris, that may be persistent for 3 to 4 days. And they are normal when the seventh nerve is non-functional. Tell me what can be the seventh nerve? Seventh cranial nerve? Seventh cranial nerve is facial nerve. Okay? So if facial nerve is non-functional, this test will not affect it. But this test will be affected if you have neuropathy of 8th nerve. All right? Now, ABRs are generated in response to sound stimulus presented to ear and picked up from the scalp. Okay? So there are two tests, remember, OAEs and ABRs. Okay? These are generated into the response that you send to the scalp. With response of 30 to 35 dB NLH, the infant who passes the test and the hearing is considered as normal. But if the infant fails the test, you have to follow up the patient and repeat the test again. Okay. So remember, there are two tests you can do to screen the neonate, OAEs and ABRs. OAEs are otoacoustic emissions, where you send a click sound to the cochlea and see if that patient is able to respond to that sound or not. And the other is auditory brainstem response. Okay. Where you stimulate the sound to the ear and it is picked up from the scalp. If the child responds to that sound, he passed the test, and if he does not, then you have to repeat the test. I think we are done with the topic. We'll just have a small brief overthrow of the topics. We have learned screening of neonates. We have learned tympanometry. A wave is normal, remember. AD is deep wave, AS is shallow wave, AS is seen in otosclerosis, and AD is seen in ossicular chain disruption. Compilance is increased in AD and compilance is decreased in AS. Okay, B is indication of fluid in the middle ear. What is Vincent angina? Vincent angina is a typical disease of the orgasms by fusiform bacilli and spirochetes. The patient will have low-grade fever and discomfort in the throat. What is caloric test? You do this test to see if the patient is having vertigo due to Librinet or not. Here you induce cold water and warm water and you examine the nystagmus and the side of nystagmus. Normally, when you induce cold water, the nystagmus should be on the opposite side. And when you induce warm water, the nystagmus will be on the same side. What is Gelli's test? You use a tuning fork, put it behind the mastoid bone, and you increase the pressure in the ear by using a Sigel speculum. Okay, normally the hearing, there will be decrease in hearing if you induce pressure in the normal ear. But it is negative when ossicular chains are fixed or either disconnected. All right. What is Weber's test? You vibrate the tuning fork, put it on the temple or the parietal bone of the patient. Normally, it equalizes, right? If it lateralizes to the worse ear, from the ear where patient is complaining, it is conductive deafness. Or if it lateralizes to the better ear, it is a sensory neural deafness. What is Rennie's test? Remember, Rennie and the penny. You vibrate the tuning fork, put it on the mastoid bone that's behind your pinna. Normally, air conduction is better than bone conduction. If bone conduction is better than air conduction, it means that the patient is having conductive deafness. Coming back to the long answer we had today, that was physiology of hearing. Remember that the sound enters from the environment into the pinna, passes into the external auditory canal, and strikes your tympanic membrane. From here, the vibrations of tympanic membrane are transmitted to the stapes foot plate, and from there, it will stimulate the ossicles. Now, these ossicles, will move the stapes foot plate, and it causes the pressure changes in the librinate fluids. These librinate fluids will stimulate the basilar membrane, and these basilar membrane movement will stimulate the hair cells of organ of Coti. We have two cells, outer and inner. Now, these hair cells are fixed above the nerves. So it is these hair cells which act as transducers and convert the mechanical energy into an electrical impulse. And this will travel to the auditory nerve. From the auditory nerve, they will enter into the spinal ganglion in the cochlear nerve, right? And from there, it will transmit an auditory pathway where you have a first order neuron, second order neuron, and third order neuron. So remember the brief part which you should mention in the exam: mechanical conduction of sound, transduction of mechanical energy into electrical impulses, and conduction of electrical impulses into the brain. This is known as neural pathways. Okay. I hope everyone liked the class. This is it. Thanks for watching. You can follow us for more on social media handles like YouTube, Instagram, Facebook, and Telegram. Keep following us to have more live classes on other subjects as well and for ENT. Thank you.